your doctor has recommended that you get some treatment, some chemotherapy. And there have been some choices, and you've kind of narrowed it down, and you've made some choices based on maybe side effects or what you've read or heard. I think most docs are going, and practices are going to give you good information. There's very rare cases where docs are not practicing good, solid, standard of care, high-level cancer care. So I think in the United States today, you should have that basic expectation. It's the exception that's really maybe not as informed. So I think trusting your doc is a good thing. Making decisions is hard, I think. Sometimes, you know, we've all been trained, is the doctor the paternalistic, I'm going to tell you what we're going to do, or is the doctor the other side of, all I'm going to do is give you the information and you have to pick? Well, the reality is it ends up somewhere in between for almost all of these. You know, you educate, the patient has some influence, and then the doctor decides in the end. And so that shared decision-making, I think, is best for most patients. It's unusual where, unless you as a patient are kind of a control freak, where you say, okay, tell me all the choices, I'll get back to you, versus, you know, more, well, what's your opinion? What do you think? Here's my bias. Most patients pick therapies based on, first, how well it works. So efficacy is the name we call that. Second, the side effects, the impact on one's quality of life. How hard is that going to be on me? Will I be able to work? Will I be able to function and drive? And ask those sort of quality of life. How long am I going to be on it? How are you going to figure out if it's working? Just a roadmap of how things are going to go over the next several months is a normal communication, normal expectation, and I think an important core base for a patient to know before making a final go-ahead decision.
When I evaluate patients and decide a treatment option, the most important thing is, number one, seeing the patient personally, talking to the patient and trying to understand what they comprehend about their diagnosis, what they've learned from either the tests that have been completed thus far, especially if you've come from another institution, because sometimes it's the interpretation that is actually not correct, or sometimes they've not been provided the correct information by their previous caregiver. So I take all those things into account, as well as the most recent diagnostic imaging you've had, your energy level, your nutrition level, what existing medical conditions you may have now, what kind of social support system you have. So all these things do come into one big decision plan before I make the final decision about which treatment to choose. And then that's when I discuss it with you. And sometimes there are two options, and they're fairly equivocal, maybe, but they have different toxicities. So then we need to talk about the toxicities of therapy and seeing which ones you are willing to accept or not accept at that time period.